This video describes placement of a horizontal mattress suture modified with a locking technique. Initiation of placement of this suture is the same as with a typical horizontal mattress suture. You'll take a larger bite, usually about a centimeter from one of the wound edges. You'll pull your suture through the center of the wound, and you'll place your suture equidistant exiting the tissue on the opposite end of the wound. The advantage of this suture, as with any horizontal mattress suture, is in taking larger bites, you are able to achieve better eversion of the skin in the center and also avoid puncturing any macerated or damaged tissue. You'll then walk the suture about a centimeter down on the same side of the wound, enter on the same side through the epidermis, exiting through the cut edge of the wound, and you'll reload your needle to again exit on the opposite side of the wound such that you've created a box shape, as with a typical horizontal mattress. Here's where the difference is. You'll leave a loop of suture on the far end of the wound, and you'll simply drop the needle through that loop. As you pull it through, it creates a locking effect, which drags the suture material on the far end of the wound across the wound edge. You'll then tie off your suture in a usual fashion using the instrument tie method. The advantage of this method is that the suture material traversing the wound prevents any splaying of the wound which can occur with a typical horizontal mattress. A variation of this technique can also be achieved. Rather than dropping the needle through the center of the suture loop, you'll instead wrap the suture end with the needle still attached twice around your needle driver, and you'll pass your needle driver underneath that loop of suture, grabbing the free end of suture material and pulling it through, effectively tying your knot through the center of the loop. This will also achieve that same locking effect, which allows for great wound edge eversion, but also prevents the splaying that can sometimes occur with placement of a traditional horizontal mattress suture in the center of the wound. The size and type of suture that you choose will depend on the area of the body. In this demonstration video, a 4/0 nylon suture is used, which is appropriate for closure on the extremities and the trunk. Special thanks to the authors who conceived this technique and described it previously. For more information on this and other basic and advanced wound closure techniques, visit www.lacerationrepair.com.